Patient safety is everyone's responsibility. It really is a team effort.
It is a team sport. It involves doctors, nurses, social workers, but it really involves patients as well. And it's going to require all of us as a team.
Patient safety is a big initiative at our hospital. The staff takes it very seriously, and the whole team, just not the clinicians that are on a specific nursing unit, but housekeeping, our lab, respiratory therapy, anybody who walks onto that nursing unit or in an outpatient area that is seeing patients, taking care of patients, we make sure that the environment of care is safe.
Upon hire, we orient all new employees regarding patient safety, and that includes how to report events to the patient safety department, and we teach them about the Joint Commission's National Patient Safety Goals. The National Patient Safety Goals include use of 2 patient identifiers so that we properly identify patients for all procedures and testing, etc. They involve looking for infections, all kinds of infections, monitoring for those and keeping patients informed of that. They involve looking for potential suicide patients, asking the right questions when they come in so that we can get them the proper resources. They also involve looking at our clinical alarm systems, making sure that the alarms are heard and they're answered properly.
We have annual competencies that are based on our nursing strategic plan and the plan for the organization to provide safety for all of our patients and employees too. We want to make sure that no one is injured while they're in the hospital. The standards are shared, and a competency is developed, which is a checklist that we teach, and then we ask the staff to demonstrate these competencies.
We monitor patient safety in-house, and we do that by asking and encouraging our employees to tell us when things happen so that we can look at the hospital processes to see, is there something else we can do so that doesn't happen again? We have an internal electronic reporting system for that. From the other side, from the regulatory side, we're mandated to report certain events. So it's actually looked at internally and externally.
I think we do a pretty good job. We're very willing to go to our manager if we see something that is not safe for our patients. We also have the SRMs that we can put in if we see something that is alarming, that we can go in and make that report.
Every department has a safety board, so if there's a bigger issue, something that can't be solved right away, we kind of put that on that board and then we work on that to improve safety for the patients.
I'm also one of the Safe Choices facilitators for the Duke LifePoint Safe Choices program, so I think that's a big initiative from Conemaugh to pick up from Duke. We've started with the leaders to bring them all through the program and show them kind of a culture that you can create to make sure your employees know that they can come to you to report any safety issues, to make it more safe for our patients. So I think as everybody goes through that program, that's one more initiative to get us where we want to be.
The 2 patient identifier is a national patient safety goal, and we here at Conemaugh use the patient's name and date of birth, and we are to use that every time we interact with the patient.
We have it set up so that as soon as we scan their armband, it prints the labels, and then we have the labels right there that we can double check with their armband to make sure that's the right patient. So.
Patients do get confused by that. They think, I'm here, I've been here several days, why don't you know my name? But it's something that we do to make sure that we don't make a mistake. We prevent harm to the patient. And if we get bogged down with all sorts of tasks, this keeps us on track. We also have something called the barcoded medication that we use. We barcode all our medication. The patient's wristband has a barcode on it. And when we deliver medication, we're able to compare that barcode on the medication to the patient's wristband to make sure we have the right medication. And if it doesn't match up, then the nurse is to pause, go back to the order, make sure she has the right drug, and this has cut down on some of our medication errors.
As a pharmacist, I go through and I make sure that every medication has an indication so that there's nothing unnecessary the patient's taking. I also make sure that all the dosing is appropriate for the patient's age, for their renal function, for their liver function. I run a drug interaction check so that there are no big interactions with the medications that could potentially cause patient harm.
The one thing that's really, really important that we depend upon our patients and our families to tell us is what medications they're on. It's great when they come in with a list, they know the dose, the name of the drug, and when they took it last. This helps us provide very safe care. We also have a process that we use before surgery and procedures. It's called the timeout. We compare what the procedure is, whether it's the correct site and side. Do we have all the equipment there? Has the patient signed the consent? We verify all of that before the procedure. And that's to prevent wrong site surgery.
So the robot is a tool which controls the actual instruments that enter the patient. The actual control of the instruments, how they work, what they use, how they operate is actually controlled by the surgeon who is sitting at the robot control panel. The robot gives the surgeon a magnified view of the anatomy. In addition, the image shows up in 3 dimensions rather than a flat 2-dimensional image on the screen. This allows the surgeon to be more precise in his dissection and really gives better visualization of what he's doing. Conemaugh got the robot in 2012. They started the robotic surgery program. Since that time, over the last 5 years, we've performed 1,943 operations. That total continues to rise every day as we do more cases on a daily basis. Thus, you have a very experienced robotic team when you go to the operating room for robotic surgery. The OR staff in the operating room goes to a special course where they get introduced to the robot and learn how to use it. They then are involved in every case depending on no matter who's doing the surgery. Thus, you have a team of nurses that are specially robotically trained so that they know exactly how to use the robot and how it functions. The surgeons that use the robot generally go to a course to get introduced to the robot. They go to observe cases by another experienced surgeon who's doing robotic surgery. Then they get preceptored in their first several cases to ensure that all goes well.
Our fall prevention standards are based on documentation in our EPIC electronic medical record system and also tools that are evidence-based practice. And yellow for caution is the color for fall prevention. So we have yellow armband that we place on a patient when we assess them at a certain risk score for falls. Not only the nursing staff, but also any department that patient may go to for testing, they know that that patient may be a moderate or high risk for fall by seeing the yellow armband. We also put yellow slippers on, and they're yellow no-skid slippers. We also have a yellow star that goes onto the patient's doorway that tells everybody that is entering that room that they know that that patient is at risk for fall. We prevent falls by educating the family and visitors also. When they do leave the bedside of the patient, they need to ring the bell. Don't leave the room. Just ring the bell and tell us that you're ready to go home or you're going to go down to the cafe to get something to eat. This way we make sure that the alarms are on our patients. We have bed alarms that are activated to prevent patient falls. And when they're sitting in a chair, we have an ambulation alarm it's a chair pad that we hook up, and if the patient sits in the chair and they want to get up, we're notified because it's going to alarm. We really embrace safety for prevention. Anything that can happen to a patient in the hospital, we want to prevent.
Population health is proactively managing the health outcomes of a defined group of patients. And that could be Johnstown, could be Cambria County, could be a segment of those patients. So it's any defined group of patients. Proactive piece involves actually reaching out and trying to predict and prevent bad outcomes before they happen, as well as, of course, maintaining and promoting good health. I think the general public could expect improved and more standardized health care, more emphasis placed on what we scientifically know to be true rather than just what we think might be the right thing to do. We can expect far better, I'll say, care coordination than we've had previously. So they could expect that if they show up in one doctor's office, that doctor actually is aware of a test that was done in another hospital 6 months ago, so that there's not repetition of tests and decisions can be made quickly. Patients also should expect a more seamless experience so that they can move from one setting to another here without a lot of appointment here, go here, get a prior authorization there. Finally, what they can also expect is a little more attention than they previously felt. So more people calling and saying, it would be good if you had a mammogram. It would be good if you had this. And we do that a lot today, but I think as we really refine population health, we're going to be even more proactive. Conemaugh has a rich tradition of providing sort of community health events, whether that's screenings to a wide array of educational offerings. But we also have centers dedicated to this proactive kind of management.
So the Primary Care Resource Center is a department that was formed to help support patients and their primary care physicians in the management of their chronic disease state. So we work with members of the healthcare team to help prepare the patient for a successful discharge from the hospital and try to prevent a readmission. The different services that we will provide to our patients are disease state education, medication education, and reconciliation. So the prior to admission list, the admission list during the hospitalization, and then the list what a patient gets discharged on is evaluated by the pharmacist to look for any discrepancies or any problems. If any are identified, it'll be discussed with the patient and then also with the physician to try to get that resolved. So that's been a really helpful aspect of preparing the patient for a good, successful discharge. We'll also help with lifestyle counseling, so smoking cessation, nutrition, exercise. Also help patients with transportation assistance. So those who qualify can get free rides to their primary care physician of follow-up appointments, which as soon as the patient sees the physician prior to or after discharge, the more likely they are to stay out of the hospital. Our nurses will also perform home visits for our patients. They'll kind of assess what the patient needs in the home to help keep them safe and keep them healthy in there. It's for our patients who are very high risk for readmission or have had multiple readmissions throughout the year. They require extra help and support. So each week we present a new patient to a multidisciplinary team to sit and discuss a patient and try to figure out what all needs they have and how we can help that patient. So once that case is discussed, we come up with a very specific and individualized plan and then follow the patient very closely and help implement those measures so that they can stay healthy and stay at home.
On a broader level, we have in the last year brought up a comprehensive health record, Conemaugh Connect, so that a patient in our system, that the patient comes to the hospital, comes to the office, the entire patient's record is available to the provider at the time. A further example is our East Hills facility. A lot of care can be delivered under the same roof, so one-stop shopping, as it were. I would say our patient safety initiatives impact population health. We have what's called a clinically integrated network, which is led by physicians. So in our network, physicians oversee population health. In order to make population health work well, everyone has got to work together to, again, proactively manage health outcomes. So everybody's involved. And that would include patients too. A lot of emphasis on delivering the right care, right place, right time, but also in the most efficient, effective, cost-effective